What is the sphincter of Oddi and its role in ERCP? Imagine a tiny but mighty muscular valve that acts as a gatekeeper at the point where your bile and pancreatic juices flow into your small intestine. That's the sphincter of Oddi. It's located where the common bile duct and pancreatic duct meet the duodenum, the first part of your small intestine. This small muscle controls the releases of digestive fluids from your liver, gallbladder, and pancreas into your digestive system. Its main job is to regulate when these fluids are released to aid digestion, prevent backflow of intestinal contents into the ducts, and keep the pressure within these ducts balanced. In the world of pancreatic health and pancreatic cancer, the sphincter of Oddi is especially important. If it doesn't work properly, a condition called Sphincter of Oddi dysfunction can occur. This can cause bile or pancreatic juices to back up, leading to symptoms like abdominal pain, nausea, or even inflammation of the pancreas, known as pancreatitis. While dysfunction of this valve isn't a direct cause of pancreatic cancer, understanding its role helps doctors diagnose and manage symptoms that might be related to pancreatic or biliary diseases. Now, let's talk about a common procedure called endoscopic retrograde cholangiopancreatography, or ERCP. This is a specialized technique used to diagnose and treat problems in the bile ducts, pancreatic duct, and gallbladder. During ERCP, a flexible tube with a tiny camera is inserted through the mouth, down the stomach, and into the duodenum. The doctor then locates the opening where the bile and pancreatic ducts drain into the intestine, which is guarded by the sphincter of Oddi. Using this approach, the doctor can inject a special contrast dye to take X-ray images of the ducts. This helps identify blockages, stones, or abnormalities. If there's a blockage, the doctor can perform treatments like removing gallstones, placing small tubes called stents to keep the ducts open, or taking tissue samples if cancer is suspected. Because the sphincter of Oddi is right at this opening, it often needs to be carefully managed during the procedure. Sometimes, if the sphincter is too tight or not opening properly, the doctor may perform a sphincterotomy, making a small cut in the muscle to help improve drainage and reduce symptoms. This can also make it easier to access the ducts for further testing or treatment. It's important to remember that while ERCP is a valuable tool, it does carry some risks. These include pancreatitis, bleeding, infection, or even perforation of the intestine. That's why the decision to proceed with ERCP should always be made by a healthcare professional, after carefully considering the individual's symptoms, medical history, and the potential benefits versus the risks. Understanding the role of the sphincter of Oddi in this process highlights how interconnected our digestive system is. Proper function of this tiny valve is essential not just for normal digestion, but also for diagnosing and managing conditions like pancreatic cancer or biliary diseases. If you experience symptoms such as persistent abdominal pain, jaundice, or unexplained weight loss, it's crucial to seek medical advice. These could be signs of serious conditions, including pancreatic cancer. Always consult your healthcare provider for personalized guidance and treatment options, and remember that medical procedures like ERCP are performed with the goal of providing accurate diagnosis and effective care.